Well, look, thank you, everyone. I, of course, want to send a big shout out to my dear friend and caucus colleague, Katie Gallagher. She has her daughter at home with COVID, one of the 17 infections in Canberra. I texted Katie this morning, of course, she's thinking of everyone else, which is so Katie. So a really big shout out to her. The case numbers in Western New South Wales have increased quite dramatically today. We now know that there is COVID positive infections along the Darling River from Walgett through to Wilcannia, including Burke. There are fragments in the sewerage in Bathurst and in Orange. We know there are cases in places like Mudgee as well. So what we are really seeing is a growth in COVID infections across the West. And in those communities of Wilcannia, Burke and Walgett, the Aboriginal population is over 80%. West Dubbo is where the most infections are, and West Dubbo is where the Aboriginal community lives in Dubbo. The numbers today have gone up by something like 23, which is a very large number, particularly out there in the central West. People are anxious and people are fearful. Yesterday, the government made an announcement that they would be sending ADF and AUSMAT out there today. And of course, this is welcome. However, if the strategy is to be successful, they have to pay attention to cultural sensitivities, and they have to pay attention to making sure that whatever they do, wherever they go, that they have trusted elders and Aboriginal community people with them. Otherwise, it will not work. Labor has a 4-point proposal that we're putting forward today to deal with the West. I am fearful that what this will become is a game of whack-a-mole. So where there is a problem in the Aboriginal community, dispense the army, treat it as emergencies. That is short-sighted, that is inappropriate, and that is not the way forward. The government, both state and federal, should have been prepared for this. So the 4 points are these. We want to see better coordination. There is the capacity in these regions to deal with the issue of COVID. There is the Rural Health Network. There are Aboriginal Medical Services. There is the PHN Network. And of course there is the Commonwealth. We now see that there is the military. There is capacity. What there isn't is coordination of these resources on the ground. So we are calling for that. And to recognise, and it's just so stark, that the numbers of people vaccinated is dramatically different between places like Queensland and New South Wales, which is about 8%, even lower in the West, to something like 30 to 40%.
Hey guys, can you put your phones on mute if you're not asking a question, please? I just hear the background noise in the microphone. It's not working very well.
I'm nearly finished.
Hello, are you there?
They're on mute.
No, they'll be able to hear us if they're on mute. Okay, as long as they're on mute.
The dramatic difference between Victoria, which has over 40% of its Aboriginal community vaccinated, and places like Queensland and Victoria, and places like Queensland and New South Wales, which is about 8% and even lower in the West. Now, the reason there is a difference is because in Victoria, the Aboriginal community-controlled health organisations ran the vaccine program. That is the big difference. We want to see more vaccines, more testing, and of course, more tracing. The idea that vaccines had to be rushed out to Western New South Wales suggests to me one thing, and that is that there was an absence of vaccines in the first place. The fourth thing we want to see, and this is just so important, is localised data. You cannot make decisions about vaccine rollouts unless you know what the data is at the local level. It's good to have national statistics, but it's the local level that will make a difference. And the final thing that we are suggesting in our plan is to be absolutely clear in an appropriate way with the community what this terrible disease can do and what could happen if hospitals become overwhelmed. In many of these communities, there isn't a doctor, there isn't a pharmacy, there is not a hospital. There are small hospitals in some places, large hospitals in places like Dubbo and Bathurst. So people need to know what the consequences are for not getting vaccinated. Not with the finger waving, but sit down and have a conversation. Door to door is the answer.
Cameron.
Cameron?
Thanks, Linda. Look, I just have two quick questions. The first one is, do you think that anti-vaxxer sentiment or vaccine hesitancy is proving to be a factor in why some of the vaccination take-up rates are so low across the different jurisdictions? And the second one is just in regards to Aboriginal communities in Western Sydney. We're seeing a lot of cases there. Obviously, it's the epicenter of this situation in New South Wales. Do you think the state government should set up more mass vaccination clinics to help some vulnerable populations there, like Aboriginal people, get vaccinated faster?
Thanks, Cameron. The first point about vaccine hesitancy is I am not going to do what the federal government has done and blame the low vaccination rates on vaccine hesitancy. The vaccines have not been available for people to get vaccinated, and there's been no real appropriate explanation to people about the importance of vaccination. Vaccine hesitancy is present. However, it can be dealt with. It can be dealt with by conversations. It can be dealt with by role models. It can be dealt with by people having discussions in family groups. And we are seeing in some places, for example, a Wabakal medical service in the Hunter, which is a really big medical service, no vaccine hesitancy because of the way in which the medical service has approached that issue in the Hunter. On the issue of vaccinations in Western Sydney, we know that in Western Sydney there are about 50,000 First Nations people. It is a huge population. In fact, it's the biggest in the country. And there needs to be more vaccination clinics. But what I would also suggest is pop-up vaccination clinics so that they can be localised. It's not a hard thing to do. The resources are there, the capacity is there, there has to be the will.
Sarah.
Sarah?
Hi, I just want to ask about vaccination rates in Indigenous communities on the other side of the country. WA.
Yes.
We saw yesterday some figures came out. The government was quite welcome figures that showed national average was at about 15% for full vaccinations for Indigenous people, but in states like WA, that's as low as 5%. What's your response to that kind of figure, and are you concerned?
Just wait till the plane goes.
It's very unusual to get planes, so it's sort of a welcome sound. We're in Marrickville, which is in the flight path. Actually, Petersham Park is the worst. It's stopping every few minutes. Can't even see where that's going to. Can you, Maria? Oh yeah, it's British. Now it's not time. It is. It's Thai Airlines. Yay! The vaccination rates across the country for Aboriginal people are incredibly low when they're compared with the mainstream population, except in Victoria. The NT's doing okay, and Tasmania's doing okay. It's about 20%, according to the government's rates that they published the other night. However, there is a huge concern about Queensland, New South Wales, and in particular Western Australia. I met about a week ago with the mayors from the Kimberley and the Pilbara, and their number one concern was vaccination rates in that part of the world, which were extremely low. I've heard rates as low as 4%. This is a massive issue, and this is why we are saying that the federal government has to have a national plan to deal with the issue of First Nations right across this country. We're about 700,000 people across the country, roughly, and people live in very identified communities, and it is within the scope of the federal government to have a national plan and for state governments to cooperate as well.
Just a couple of questions.
Yes,
Colleagues.
Amy.
Thanks, guys. Just go on mute. Thanks.
Thanks, mute, Sarah and Cameron. Thank you very much, or you can hang up if you want to.
You mentioned that Labor's
Thank
supports
you.
sending ADF vaccination teams into Western New South Wales. Can I just get you to talk through why you have that position? Why do you support sending the teams in? How do you think they'll be received? And do you think they'll help boost vaccination rates?
Labor is of the view that this is too little, too late. Of course, it is welcome that the ADF is involved, but it will not work. People remember the Army's role in the intervention in the Northern Territory. If it's going to work, if it's going to be successful, it has to be done hand in glove with the local Aboriginal community. Otherwise, it is going to be extremely difficult. These are traumatized communities, and it takes a long time to build trust, particularly around the issue of provision of health. That trust will not be there with the ADF. So what I'm saying about the ADF, of course, it's welcome, but it must be done in absolute partnership and at the direction of the local Aboriginal community, particularly through the Aboriginal Medical Services.
Do you think it will help boost vaccination rates there?
Look, it will help boost vaccination rates if the advice is heeded, if people tread softly and recognise that the ADF is not the answer right across this country. We can't have emergency responses in the way in which this has been rolled out. Suddenly there's a problem. Hello, that community's been sitting there. It is huge. Why wasn't the government of New South Wales and the government, particularly federally, who's responsible for vaccines, prepared for this?
Something you touched on a bit earlier as well. The Minister for Indigenous Australians has said several times that there's vaccine hesitancy as one of the reasons preventing the vaccine take-up. You mentioned you don't think that's the only reason, but why don't you accept that? And do you think there's more the government could have done to prevent hesitancy?
I I am familiar. I have spent many, many, many days and weeks in the Western Division of New South Wales. I know the communities, I know the towns, I know many of the people. So I know what I'm talking about. Right down the Darling into Menindee, down through Danton, Kumiala, right down to the southern part of New South Wales. I know these areas. I know Dubbo really well. I know Wellington really well. My children's grandmother's from Wellington. She's a Riley. So the blame or moving the responsibility and saying, oh, it's all about vaccine hesitancy, to me is a cop-out. People are not familiar with this disease. It's been very much concentrated in the city. There is enormous amounts of misinformation on Facebook. Once people know the facts, and this is why our fourth pillar of our plan is to make sure that people understand the facts, make sure that people understand the implications of breakouts like this one. Understand that the way to deal with this is through vaccines. People just need an explanation. They don't need to be blamed. That's it.